Okay, they are live now.
Awesome. Well, thank you very much for helping us get going on StreamYard. We're not very familiar with this platform, so I'm grateful for your help. So we have people here now, Era, that can see and hear us. Is that correct?
Yes.
Awesome. Well, welcome everyone to the Freedom for Nurses workshop. I want to just thank you guys for showing up. I want to thank Katie and her team at Nursepreneurs for hosting this. And I just feel so honored that Katie and Nursepreneurs, we're the only legal nurse consultant training platform that they actually endorse. So I just want to thank you, Katie. Thank you, Nursepreneurs, and thank everyone who has joined us today. I want to kick us off by just letting you know who we are. I want Rob to introduce himself. I'm going to introduce myself. And then we want to find out a little bit about you guys as well. So I will let you know right up front, this is a very interactive workshop. This isn't like your typical webinar where you're just like, chilling out and not really doing anything and we're just talking at you for an hour and a half. This is very interactive. We want to hear from you guys because this whole point of this is you. So get your chat ready. We're going to do our best to be super responsive in the chat. I believe going through StreamYard, there is a little bit of a delay, but we'll do our best to make sure that everyone's super involved because, again, this is about you and your future. So, Rob, why don't you go ahead and introduce yourself and tell them who you are, man?
Yeah, first of all, I just want to, again, thank Nursepreneurs as well. Also, thank you for coming and spending your time with us today. The first thing I'll just say is that I got to get the cat out of the bag. I am not a nurse. I always have to kind of give that disclaimer. But what I do bring to the table is a lot of entrepreneurial experience and business experience. And so love the opportunity to help nurses become legal nurse consultants with Randy and our team. Just a little brief background about kind of where I come from. I'm really focused around the digital marketing space and business growth coaching for the last probably longer than that now, probably more like 17 to 20 years, but it's been a blast, a journey, and I love helping people succeed. In that journey, I've had the opportunity to work with a lot of different types of businesses, worked with 6, 7, and 8-figure businesses, as well as building some 7-figure businesses as well. So super excited to have each of you on the workshop today and look forward to talking about how legal nurse consulting can be, a path to freedom for you.
Yeah, man. Looks like we need to update our slide, right?
Yeah.
Now you've got multiple 7-figure businesses and you've been doing it for 20 years.
That's right.
I think we need to update the slide. And I'm Randy. My name's Randy Loveless. I've been a nurse since 1999, or as the kids say, back in the late 1900s, which doesn't make me feel old at all. I'm a bachelor's prepared nurse, have my bachelor's in management as well as a master's in business administration. I've worked from bedside in the emergency department through the executive realms up through chief operating officer and healthcare executive coach and consultant before leaving all of that to start my own legal nurse consulting firm. That legal nurse consulting firm really took off. I figured out how to be successful in that. It took me a year plus to really go through all the hard knocks and failures to learn how to do it the right way. And then once I started becoming really successful, the world started noticing. So I was on an Action and Ambition, which is the Entrepreneur Magazine podcast. Multiple articles written about us and the work we were doing. This is a Yahoo Finance article. I was on the front page of Excellion magazine. We invited to be a member of the Forbes Business Council. And then most recently, this is actually news that is not really out there yet. So you guys get to be the first to hear it. I'll also be a presenter and speaker at this year's ENA conference, the Emergency Nursing Conference in where are we going? New Orleans. It's in New Orleans in September. So that'd be pretty fun too. So Rob, why don't you kick us off with kind of the agenda, and let's start out with that poll after you kind of go over the agenda.
Yeah, the poll's going to work a little bit different because we usually use Zoom and you can interact that way. But what I'll ask you to do instead is if you could just type in the chat in the comment area. We're going to ask you a question, and that question is, number one, where like, where are you in terms of knowing about legal nurse consulting? So do you know much about it? Have you been exposed to it before? Kind of give me a feel within like the comment section, the chat section, like what your experience is with legal nurse consulting, how much you've learned about it. Then we're gonna, as you do that, we'd also like to know kind of where you're calling in from. We always like to see, where everyone is and throughout the country. And in some cases, we have people from outside the country as well. We're going to talk about what legal nurse consulting is, some common myths about legal nursing. We're going to do a pretty cool case walkthrough. Randy's going to walk you through behind the scenes, what it's like to be, running a case. And then we're going to talk about the catalyst pathway to being able to basically take you from bedside to successful legal nurse consultant.
And I see Queen Me is in Tampa, Florida.
Awesome.
And I see Lazarus said, thank you. The rest of you guys, just type in where you're calling in from and maybe how familiar you are with legal nurse consulting. Some knowledge, Milwaukee, awesome. Lazarus, thank you. And I know there's a bit of a delay, so you may have typed it in already and we don't see it yet, but we will keep an eye on that. And Rob, just let me know as you see people coming in, man, just butt right in there and tell me what you're seeing.
Sure.
I want to go ahead and jump into the actual presentation and shed a little more light for those of you who may not know what legal nurse consulting actually is. This is going to be brief, but I think it still might be a little surprising because the number one thing that a legal nurse does is educate attorneys. And I will actually pause on this educating attorneys and let you know that you guys are actually super lucky because we have two of our students who have come through Catalyst who's actually on this call with us right now. You can see them here, and I just wanted to pause and introduce them as well. Andrea Rich is there and Amanda Bohr is there. They've actually come through Catalyst. They've come from bedside, whatever they were doing in their nursing career, switched over to being successful entrepreneurs, and they're now both running very successful legal nurse consultant businesses. So Andrea and Amanda, thank you guys for being here. I also will tell you guys, feel free. This is not like some stuffy, we're going to, like I said, yap at you for an hour or two. Interact. If you have questions at any time, throw them in the chat. If you've got questions for me as the owner of the company, Rob as my partner, Andrea or Amanda as people who are literally in the program right now, who have been through it and started their own business, please just throw it in there. And would love to interact with you guys in that way. So educating attorneys. Educating attorneys is a surprising thing that we spend, to be honest, the majority of our time doing. And we literally start from the moment that we interact with them the first time. Marketing, a lot of marketing is about educating attorneys because I would be honest, a lot of them don't even know we exist and they don't know what we do. So we start off our relationship a lot of times by educating them. And then guess what? These guys are super smart, but they're not in the medical field. They're not nurses like you. They don't know the behind the scenes of the healthcare world. They don't understand the documentation. They don't understand the lingo. So when an attorney reads an MRI, and I'm telling you this because they've told me this, I literally have had attorneys like, man, I BS the crap out of it. I understand a little bit and I'll Google a little bit, but then I Google it and I don't understand what the Google tells me because then there's like 10 words in there. I don't know what it's saying. So then I have to Google those. So us being able to educate them on what they have in their case from a medical aspect is huge. And we do that by reviewing the case. So we get all the records, we review it, analyze the records, and then what we do is we present that information to them in what's called a chronology and a report. So we're taking the medical records, putting them in order, teaching the attorney what's in them, telling them what's relevant and what's not relevant, and then helping them form their cases from that medical aspect. That way there's no surprises when they walk into a settlement agreement or into court. They understand the medical records better than opposing counsel, which gives them the leg up. And then lastly, it's business ownership. Whether you choose to only do subcontracting on the side or subcontracting full-time or be your own business owner and go out and get your own attorney clients and make a bunch of money and have total freedom, you're still a business owner. And that is a huge shift from what we're used to. being in that glass jar, like the flea who would jump out, and they put, this is a story I just told on a YouTube video and it's fresh in my mind. They put a mesh over the top of the jar. The flea would hit it every time he jumped. And so then they removed the mesh after a while, and the flea would never jump higher than the top of the jar. Why? Because he was trained that you can't get out. And that's kind of what we've been trained as nurses, that we go in, we hit the clock. You got to be there at a certain time. You can leave at a certain time. You beg off for PTO, you work your holidays. And we think that's the best we can do. It's not. And I hope you get that from what we talk about today. But I know that there's a lot of myths going on out there about legal nursing and some just flat out untruths. So, Rob, tell them a little bit about some of the myths. And guys, as he's going through this, feel free to put any other myths or rumors that you've heard about legal nursing in the chat, and we'll do our best to answer those.
That's right. And appreciate those of you who have commented. I know there can be a little bit of a lag, so appreciate you making those comments, telling us where you're calling in from. And as Randy mentioned, please feel free to interact throughout this whole workshop. We want it to be more engaging and not just us talking at you. So the first myth that we hear a lot is that you need certification. Now, I'll just be straight with you here. I've been in marketing for a very, very long time, and it is true that there are some tactics and strategies that marketers use to, get the attention of people, to help them get interested in what they're offering. This happens to be one of those. A lot of times people, other companies out there will say that you need certification, but there's no governing body within the legal nurse consulting field. So you don't need a certification at all. And even, I would even ask Randy, like, how many times would you say of all the attorneys you've talked to, how many times have you been asked, hey, do you have a certification?
Yeah. Not only have I never, ever, ever been asked about a certification, attorneys have no clue that any training programs out there are pushing that. Not only is that 100% true that attorneys don't know about it, but dude, honestly, it doesn't really exist. Like in the context of the way that we think of certifications in nursing, where you get your, emergency nursing certification or your certification and whatever, it doesn't exist because, like you said, there's no regulatory or governing body over legal nurse consulting. So there's nothing from a state or federal government that says this is a certification. It's literally just a marketing ploy. And Rob, you know this, when we first started Catalyst, we talked about it briefly. Like, we could go get a certification that we offer. You pay the money, you fill out the right paperwork, and we could come up with our own certification. And to be honest, it just didn't feel right to us. It felt a little sneaky, a little slimy, and like we were pulling the wool over people's eyes. So your certification through Catalyst is that you're going to change your darn life and truly get freedom, flexibility, spend time with your family, travel, do what you want to with your life, and not be stuck in that jar with the flea.
Yeah. And, Queen Me made a comment, your certification is your license. In essence, I mean, obviously, you're a nurse, so you have a license.
Yep.
But in the context of like what other companies are talking about with certification, they're talking about legal nurse certification. And so what they'll have you do is like take tests and make sure that you pay them annually to maintain this certification. When in reality, all that is a revenue opportunity for them. So
Queen Me is right. Here's the transparent, and you'll find this out real quick, guys. This is me and Rob. We're not like, if you've seen other presentations or you've gone to other like legal nurse consultant training programs or platforms, you're not going to have the same experience. We're super transparent. We're going to be open, honest with you. What gets me up in the morning is helping you change your life. Helping you have a future that you never thought you could have. That's what drives me, not getting into some program and you become a number. You're a real person to me. I care about you. And certification, not only do you not need certification, you don't need, as a nurse, any training. You don't need it legally. You could put LNC behind your name and start taking cases today. But the problem is you're going to find out in this case review, on the one hand, in the case review we're going to do soon, you're going to see just how smart you are and how qualified you are to do this. On the other hand, you don't know what you're doing in some ways. Because even if you found an attorney who wanted to give you a case, and Rob was a nurse and goes out there and he gets an attorney to give him a case, even though he's never had any training or mentorship, that attorney says, Rob, I've got this case for you. This is a PI case. It's a UIM, got a low ceiling on the insurance. The SOL is coming down fast, so I need a quick turnaround time. Send me your long form contract. Send me a cost estimate. How long is this going to take you to turn it around? And how much, how much is this going to cost me? Is there a range? And Rob's going, I don't know what you just said, so I don't know how to help you. Right. And you don't know how to write a chronology. You don't know how to write a report. You don't know what attorneys are looking for. You don't know how to identify causation yet. There's a ton that you don't know. That's why you need training, not for some made up certification.
Yeah, absolutely. All right. So the next myth that we hear a lot about is the market is saturated. There's not enough business to go around. Are you kidding me? There's so many like legal nurse consultants out there. Yes, there are a lot of people that self-proclaim that I am a legal nurse. And as Randy said, you can do that without any legal ramification whatsoever. The difference here is that the mindset really has to be that there is a lot of opportunity. I don't remember the exact number. I think it was like 1.2 million attorneys in the United States. And then there's like, I believe around the range of 30 to 40,000 new law grads that graduate every year. So there is an abundance of opportunity out there. And it's just a matter of you being properly trained and you knowing how to contact those people, how to actually negotiate with them, and basically create a win-win for yourself and the attorney. So absolutely, it is not saturated. Do you have anything you wanted to say about that, Randy?
Yeah, first of all, thanks, Tina. You don't want me calling you Queen Bee the whole time. I love it. Yeah, Lazarus, you're right on. Actually, I'm going to not answer that because I get it, guys. You don't know me, right? And you're like, well, the guy wants the company. Of course he's going to say that, right? So I'm actually going to see if, oh, by the way, Rachel Toland is also a member of Catalyst. She's currently a client in Catalyst. I see she's joined as well. So now you got 3 people here who are currently in Catalyst that you can ask questions to. And I'm going to actually tap Andrea. Are you able to come off mute, Andrea, and give your thoughts? Because I know I'm in Arizona. And guys, I worked Arizona over as a legal nurse consultant marketing. I was like all up in Arizona. I was like, I'm going to run this place. And then Andrea comes in. She's in Arizona. And Andrea, what's been your experience now that I have completely saturated the market in Arizona? Have you had any luck running a business and getting any work here in Arizona?
It kind of makes me laugh very hard. There are so many attorneys in Arizona. And everywhere, honestly. So Randy went and marketed Arizona. And when I came on board, I was like, okay, Randy, you did this, and he was like, just keep going. I keep getting attorneys day after day in Arizona. Yep. And I'm like, I have not even gotten outside of Arizona in my own marketing. And because I still am getting new ones, almost weekly for the past few months. So there is no saturation. There are a lot of attorneys out there.
Yeah, and that's just here in Arizona. We already, just because I've marketed Arizona, I was like, there's nothing left in Arizona. I've got to go outside the state. So we have attorneys from California to New York and everywhere in between. And then Andrea comes in. We've got multiple people in Catalyst who are right here in Arizona, and all of them are getting clients. And I'm like, well, why you look over me and go to Andrea? I don't know, but there's so many attorneys out there, and I've never heard anyone come through Catalyst and then go to marketing, and after marketing the way we teach, say, I can't find any clients. The market's too saturated. It's just not. It's
Absolutely.
Simply not.
All right. So let's move on to the next myth, which is that you can only practice in a state where you were licensed. This is not true because you don't need a license within the legal nurse consulting industry. You don't need one because you're not doing patient care. In this instance, you're working on behalf of the attorney, right? So you're doing behind the scenes work, reviewing medical records. So because you're not engaging in patient care, you don't need a license to work in other states. It's pretty simple. Is there anything else that you wanted to add to that?
No, Rob's spot on. You need a license as a legal nurse. As a nurse, but as a nurse, you can be a legal nurse. And as a legal nurse, whereas in nursing, we're used to taking care of patients, so we have to get a license in each state or have a compact license. It literally doesn't matter because you're not taking care of patients. You're just reviewing records. It's not even a patient. You'll find this real quick in legal nursing. We don't call them patients. That takes a while to get that in my thick skull, at least. I kept calling them patients. They're clients because they're not actually patients anymore. They're clients of the attorneys, and you're reviewing their medical records that they've given you access to. So you're not actually taking care of patients, so you don't need a license in each state.
That's right. And then the last myth that we're going to go over today is just that all LNC education is the same. This is absolutely not true. Just like it's not true with, any other training that you could potentially get out there in the world. So, even universities and colleges, and they vary, right? From even how in depth they are and the qualifications that instructors have and different things like that. So one of the things that makes Catalyst unique is that, number one, Randy has built a successful legal nurse consulting business. It's not like he's just like going out there and be like, hey, I'm going to teach you how to do something I've never done before. You've got, so there's that one differentiator right there, is he actually has a successful legal nurse consulting business. So there's that. Number two is, when we built this program, we looked at the different gaps out in the marketplace and thought, okay, because we talked to hundreds and hundreds of nurses, and they'll say, well, how do you do this? Or I learned from this. I didn't learn this from this program. I didn't learn this from this program. And so we were able to identify the different gaps that there are in the marketplace in terms of like what is needed to actually be a successful legal nurse consultant. Because we're not going to just throw a big binder of information at you and be like, good luck. That doesn't serve you. It doesn't serve us. It's not going to benefit anyone. So we have a very, very specific path that is proven that we lead you through. And really the difference is like, are you willing to commit, and are you willing to follow that path? Because it's proven. And there isn't really any question about whether you can be successful other than your commitment. And so I would just say that we're going to go over that path later in the presentation. We're going to talk about what that path looks like, what you'll learn, all the things that you need to become a very successful legal nurse consultant.
Yeah. Thank you for answering that, Andrea. Tina, it is the same thing for nurse practitioners. We have multiple nurse practitioners. We have LPNs, RNs, NPs, CNOs. We've got bedside nurses from every specialty you could imagine. We've got directors. Anyone who's a nurse can be a legal nurse. And yes, Rob, you're 100% right. I think the huge differentiator, there's a number of them, but for me, it's that, and Andrea, Amanda, Rachel, feel free to chime in on this as people who are in Catalyst. But to me, the biggest differentiator between Catalyst and other training is that we actually walk the path with you. You don't join a program that you become a number in and we give you some information, you watch some videos and you're done. We get to know you. If you get in Catalyst, you actually have a community around you that cares about you, that is walking it with you, that is helping not just throw information at you, but coach you and mentor you along the way.
Yeah. And let me just say one other thing. I do think that is probably one of the things that we hear a lot. Randy does a lot of case studies, and you can go and look at those on YouTube, but with clients that are successful. But one of the things they say is like, I like you, Randy, and you're okay, Rob, but it's really the community that makes the biggest difference. And I would say that just as an entrepreneur, having done this a very, very, very long time, it can be lonely. And to have a community like Catalyst is like, I wish I had that when I started doing my business, because it just makes all the difference in the world. You have all these people that want the best for you. And it's not like this like dog eat dog world necessarily. Like, I'm going to, cut you off. Right.
Right.
We really endorse, or we really promote an abundance mindset, that there's enough work for everyone. Right. So I think that is the thing that binds everything together, is the community that we've created. Before we move on to this most interactive part where Randy's going to talk about the behind the scenes, what I'd like to do is just get if anybody could type in what their specialty is.
Yeah. What's your specialty area? I know a lot of you guys have probably bounced around here and there, but what's kind of been home for you? For me, it was always ED. I always kind of emergency departments where I did most of my work. As an executive, I was over a lot of different departments, but ED's been my home. So what's been kind of your home in nursing? Go ahead and type that in. I know it's going to be a bit of a delay. While you're typing that in, I'll say to that, all education is the same. Another thing I'd encourage you to do it right now if you want to. Go Google the person who is proclaiming to be your mentor. Because if all you find is them talking about themselves, or people saying, yeah, they're really nice, or I got a lot out of the program, but I don't have clients yet. Or have they been written up in articles? Have they been on podcasts? Are they speakers at national emergency nursing or nursing conferences? Like, is that real? Or is all they're doing trying to take your money, right? So find out who the person who actually runs the program is and research them too. I'd say that's one of the differentiators you'll find.
Absolutely.
Jessica's ICU. Michelle's work comp and ortho for 23 years. Right. Rob usually tries to see who can beat me out on years.
Yep. I would like to see someone in the comment beat, was it 26 or 27 years now?
26 years, which I know Andrea has a one up on me. Andrea, how long have you been a nurse?
This is my 29th year. So
show off. Work comp 23, med surg, geriatrics, hormone, ambulatory surgery, nurse 24 years, Tina. That's awesome. And Rob, I'm going to, I can't see the comments when I switch over to my presentation, but let me know if other people chime in with where they have been. I think it's really important as we move into this next section. I love to know where you guys are working and where your experience and background is, how long you've been a nurse, owner, but my partner is a nurse 15 years. Work comp, ortho, PCU is home for me 10 years, working outpatient. Perfect. And I love when we get this big cross-sectional of nurses, because you're going to see that it doesn't really matter where you come from. One of the myths that we didn't cover, and I'll remind you guys, if there's other myths you want us to cover or rumors that you've heard or whatever, throw them in the chat. We'll be open and honest, transparent with you about them. But one of the myths that I've heard is you have to have this magnificent background where you've worked in every possible specialty area for the last 40 years and you've got a PhD and a JD and all that's bullcrap. You don't. We've, like I said, got nurses from every walk of life, and you know a lot more than you think you know. And we're going to prove that here in this little case walkthrough. Psych nursing. Oh, I love that. And it's not going to matter where your background is from, because you're going to get this and you'll see what I mean. And you'll see how you'll be able to help the attorney to actually navigate their case more wisely. So Rob, are we ready to do this?
Let's do it.
All right. Another warning for everyone. I'm going to let you know, get your fingers ready. I want you guys involved. I don't want to sit here and talk to myself. That's worthless. So I want you guys to get involved. So get ready to answer in the chat as we walk through this event. Okay, so what we're going to do is high level walk through a real case that I really had with an attorney. Now, obviously, I can't share 5,000 pages of records with you and spend the next 3 days going through it with you. But this is going to be high level, real information taken from the real case. So here's the event description. Here's what happened when we first opened the EMS record. This is what we saw happen. 56-year-old female. Primary complaint, right shoulder pain. Cause of injury, fall from standing to ground. Mechanism, ground level fall. I'm telling you, we're getting tons of information so far, right? Medical history, depression. Medication, Zoloft. Pain is 4 out of 10. And their assessment shows right shoulder pain. I ain't even going to ask you guys, tell me nothing about this, because this is so little that we really don't have much information. We know it was a ground level fall, 56-year-old lady. We know she's got 4 out of 10, some shoulder pain, and she has a history of depression on Zoloft. So let's go ahead and look at the emergency department. When they got into the emergency department, here's what the triage nurse said. Patient fell at a shopping center, slipped in meat section from meat blood on the floor, yuck, and landed on her right side, complains of right upper back into shoulder pain with right hip area pain. Hit head, no loss of consciousness, or LOC. What did the physician say? Complaint of pain in the right shoulder and right hip, as well as a head injury. The patient slipped on a pool of blood that was on the floor in the meat department at a shopping center. She hit her head on the metal base of the display, denies LOC, does not take blood thinning medication, but she does have a headache. She's been able to ambulate with help, but did notice some right hip pain when moving to the gurney. Denies prior treatment, denies numbness, tingling, or focal weakness. Pain is worse in the shoulder with movement, was provided a sling, which was helpful, denies nausea, vomiting, dizziness. Okay. Now, you guys just learned a lot about this that you didn't know before from the EMS record. The attorney, though, if he's reading this, he or she, it's probably some confusion here. Now, granted, different attorneys have different levels of knowledge depending on how long they've been doing this, and they understand some of it, but they don't understand all of it. Both the nurse and the physician mentioned this LOC. In the context that we're talking about here, I actually said it because I'm reading it like a nurse. What does LOC mean? And why did both the nurse and the physician feel it necessary to mention no LOC?
Yeah, but we know there is a little bit of a lag, so just keep that in mind. But yeah, type in what you think. Okay.
Loss of consciousness.
Tina says loss of consciousness.
Tina, yes. And I'm navigating back and forth here to see your comments. Exactly. No loss of consciousness. Why was that important? Why did the nurse say no loss of consciousness? And then the physician said no loss of consciousness and not taking blood thinning medication. What the heck is that about? Why did they feel it necessary to say that? If I'm the attorney and I don't know anything about medicine, I might be going, wait, are they supposed to be on blood thinning medication? Or are they saying they're non-compliant? I used to be a DON of a nursing home. This is triggering. I'm sorry, Tina. Don't mean to trigger you. I get it, though. Head injury. Yep. Subarachnoid hemorrhage, possibly. Love it, Jessica. Good job. What about they're saying that the physician said she doesn't take the blood thinning medication, but she has a headache. Tina says head trauma, risk of hemorrhage. Why is he saying she has a headache? Is that relevant somehow? And while you guys are typing that and I'm waiting for it to get over to me, my next question is going to be about, he says she doesn't have any numbness or tingling or focal weakness. Why is he just like throwing out this weird stuff? Possible bleed, concussion. Exactly, Jessica. Very relevant. Risk of seizure activity. Yes, you guys are thinking about this, traumatic brain injury and what's going on. She hit her head on a metal display. I want there to be, let me throw this out to you right now. I want you to have tons of questions. And you can ask those questions. I may not have the answers because I don't remember the case that well, but it's like a question I immediately think. And maybe if you've been doing this for a while, you might think it too, especially if you've been a legal nurse consultant, like some of these girls who are here with me, Andrea, Amanda, and Rachel. One of my first questions is, how big was this lady? How much does she weigh? Because there's a big difference in a little tiny lady who's 4'3" and weighs 79 pounds and a 400-pound lady who's 6'9", and they fell and hit their head. There could be a big difference in a lot of things, not just their TBI, but there could be a lot of things. There's a lot of symptomology that goes along with obesity, right? What other diseases could they have? What sort of problems, comorbidities might they have if they're overweight, right? Might they have less bone density? There's so much that goes into it that I want you guys to be asking yourself these questions, because guess what you're going to do when you're looking at a chart? You're going to try to identify those things. And guess who's not thinking those things? The attorney. The attorney ain't thinking about that because the attorney's not medical. Tina, that's the checklist for neuro exam. So she's talking about the numbness, tingling, focal weakness. Yeah, what are they? They're talking about neuro, talking about her brain, maybe even her back. And then he says she denies nausea, vomiting, or dizziness. So the attorney's going, wait, did she hurt her stomach? Like I didn't see where she had injured her abdominal region. Why is he saying, was she nauseated before? And looking back through the records, trying to see, was she throwing up on scene or something? Why is the physician saying she doesn't have nausea, vomiting, or dizziness? Yeah, Jessica, I love that. Did they do pupil size? What sort of scans did they do? Jessica's thinking like a legal nurse. Why is he talking about nausea, vomiting, dizziness? Who wants to take a stab at that? You guys know. You don't have to take a stab at it. You know why he's asking. No skin condition, any lacerations, contusions, hematomatoes. Or at least that's what we used to call them in the ED. Increase intracranial pressure. Ooh, I like it. So you guys are starting, you're thinking like a nurse, but guess what? You're thinking like a legal nurse, because what are you going to do if you don't see these things in the record? What are you going to be looking for that the attorney doesn't even know to look for? Yeah, ICP, intracranial pressure. So let's keep going on this and see what comes next. We obviously want to see what the physician saw when he did a physical exam. So let's take a look at that. Head, mild contusion to the right parietal scalp. Now, I'm going to give you guys a hint here about legal nursing. It's okay to use Google. You can Google stuff. You don't have to know everything about everything. Again, when the attorney Googles it, they go, what does that mean? I don't get it. Feel free to Google it. If you're like parietal, crap, where's parietal? I don't remember that term. You're going to take about 5 seconds to Google it and go, oh yeah, oh right. You got it, right? So feel free to Google, even as we're going through this and you're answering the questions. Mild contusion, right parietal scalp. Neck, mild diffuse tenderness about the posterior midline and the bilateral paravertebral soft tissue. Back, mild to moderate tenderness about the midline of the mid-thoracic region. Also some paravertebral soft tissue tenderness, but no step off. Guess who's confused? The attorney. Musculoskeletal, there's some tenderness about the lateral and anterior aspect of the right hip. Patient has some mild tenderness about the superior aspect of the right shoulder and the trapezius and posterior shoulder region. No specific bony point tenderness. Range of motion of the shoulder is intact, but does produce mild pain. All right, here, you're back on stage, guys. What are you seeing? What do you see? What do you want? What's your questions now that you see the physical examination? Lazarus said chat GPT. We talk about that some in the program. Definitely recommend you bring that up on your first live group mentorship session that we'll have together. Loss of consciousness, important. If loss of consciousness for severe concussion could be blood thinner. No, yep, absolutely, Michelle. C-spine. Jessica saying she wants a C-spine or a T-spine x-ray. She wants to know if there's any fractures. What else are you guys seeing here? Or what are your questions? When you look at this, what are you seeing? Brain injury, concussion can cause headaches. Absolutely. Yeah, we've got a contusion to the head. The neck and back is tender. Jessica mentioned C-spine, T-spine. We've got some stuff going on in the shoulder. Anybody know what no step off means? Or do a 10-second Google search, and then you can tell me what no step off means, and then you would know why it's important that there's no step off. All right, while y'all are doing that, I'm going to keep moving just for time's sake, because I know there's this delay. So let me ask this, actually, before I keep going. What do y'all really want to see next in the records? Now that you've got the physical examination, what would you really be looking to see? Michelle said no numbness, tingling, no cervical involvement. Okay, cool. I like that. Healed wrong? Maybe. What does everybody want to see now in the records? I'm sure you guys have typed it in, and I'm just waiting for it to go through the universe to me. 56-year-old female. Jessica wants to see some scan results. Absolutely. And I bet everybody else is probably thinking that too. I need some radiology results. I need to see what x-rays and CT showed. So guess what's next? Radiological findings. But guess what too? The attorney may not know what sort of scans or x-rays or radiology studies should be done. He might be thinking, gosh, it seems like they should have done something, but he might not know what they should have done in this instance. you guys are already thinking about, you've already said C-spine, T-spine. I know you guys are probably all thinking head CT. You know what you want to see. So if you don't see it, you're going to know what's missing. That's important for the attorney as well. All right, so they did some x-rays. They were all negative. They did a CT of the head, also negative. Then they did a CT of the spine. It showed a mild disc bulge at C23, early degenerative changes at C45. L5 and S1 appears to be a large disc extrusion centrally and asymmetric to the left at this level, resulting in severe canal stenosis. And L4-5, mild facet atrophy, mild disc protrusion, asymmetric to the left, resulting in left lateral recess narrowing, possibly affecting the traversing left L5 nerve root. Now, I'll be honest, when I first started, I can actually understand a lot of this now after like multiple years of looking it up over and over because I didn't understand it. But I had to look some of this stuff up. It's okay. Age of the patient is 56-year-old female, Michelle. Brain swelling can cause nausea, vomiting, dizziness. Yes, Michelle, it sure can. Can happen with brain injury and concussion. Medical history. Oh, this is Tina saying what she wanted to see. Medical history, current meds, who witnessed the fall, x-rays, MRIs. Love that. I would look for all of that. Right now, all we know is 56-year-old female, history of depression on Zoloft. So if you guys see this CT of the spine, what are you thinking? What was caused by this fall? Are you thinking this is some injuries from the fall? Where's your thinking right now? Ask questions, challenge. And I'm going to pause here and let that get over to me before I keep going. Most of the time, I hear the same thing first. I'm going to see if you guys say the same thing that most people say when they see this. Has neck pain, back pain, mostly muscular. Okay, Michelle. What does a client do for a living? I love that, Jessica. We don't know. We may find out as we go through the records. Sometimes you'll find something in PT or a doctor's visit. You may want to call the attorney or ask them. They probably know, but we don't know. I remember looking up the difference between an extrusion and a protrusion. That was pretty cool. Does she use assistive devices? Not that we know of. Good question. What are you thinking about these CT spine findings? The disc bulging, the extrusions, protrusions, degenerative changes, L5 nerve root compression. Probably spasm since most muscles and soft tissue involvement. Okay. There's usually a word that most nurses, when we do this, they'll gravitate toward. I want to wait and see if you guys give it to me or not. I'm not going to wait too long. That delay drives me crazy, Rob. So what I hear often is this is old, pre-existing. This wasn't caused by the accident. What word are people seeing? What word are nurses seeing that would go, oh yeah, this wasn't caused by the accident. This was old. Should have a trauma scan head to toe. Agree, Michelle. People see that word degenerative and go, oh, this was already there. Yes, Tina, correct. And I know you probably said that before I did. I just saw it pop up though. Yeah, so that degenerative changes, a lot of nurses will go, oh, it was already there. But here's my question to you. So what? So she had degenerative changes. She's 56 years old. She does. You do too if you're 56 years old. So do I. I'm pushing 50 now. I've got degenerative changes, I bet. Does that matter in the context of would she have had a disc bulge at C23, a disc extrusion at L5S1, a disc protrusion at L4L5, L5 nerve root compression, had she not fallen onto probably her butt and then hit her head? How would we know? And just because of the delay in time, I won't ask y'all to answer that. But how would we know is looking at past medical history, seeing if she's ever had a CT over spine before. Was there any evidence that she had these back injuries before? I mean, has she been seeing PT for back pain, going to chiropractic? If none of that exists and she's just been living her life and she's relatively healthy, and I mean, this stuff was probably caused by the fall. Yes, she had degenerative changes. That doesn't negate from the fact that that fall caused some injuries that could be litigated. No step off to the absence of a visible step off sign and medical imaging indicator of fracture or dislocation. Yep. Signs and symptoms are new onset. Yeah, exactly, Ada. I love that. And that's huge to grab onto as a legal nurse, because opposing counsel, right? If you're working for the defense, or if you're not, if you're working for plaintiff, the defense is going to say this: that was old. It was degenerative. She's 56. She had that before. Well, apart from evidence that she had it before, there's no scan showing it. She had no symptoms of it. She hasn't had headaches before. She never complained of back pain. You know, she ran a marathon last month, whatever. Apart from you being able to supply any evidence that this existed before, it's new, right? She had no symptoms and no evidence of it. And then the final thing was an MRI on the right shoulder that showed a full thickness rotator cuff tear. So what do you do when you fall? Maybe she did this, right? Probably tore that rotator cuff. And then she had some associated signs and symptoms. Now, these signs and symptoms were not just that day. Again, I'm taking a bunch of records over a bunch of time and condensing it into a quick walkthrough with you guys. So these symptoms started sometime after the accident. So here are some of the symptoms she was experiencing. Headaches twice a week, along with intermittent memory loss. What are you guys thinking about this? Post-injury, she's now got headaches twice a week, and she's having trouble remembering things. What do you guys think that could be related to? High blood pressure, TIA, possibly. Possibly. What else do you think that could be related to? After she fell, hit her head, now she has headaches twice a week and intermittent memory loss. Now, one of the things that I'd want to know that we were just talking about as you guys are typing your answers in, did she have headaches before? How was her memory before? Is there evidence in the past medical history that she's been struggling with memory loss for a while and she has migraines? Even if she did, how often does she have migraines before? Once every 2 months. Now she's got them twice a week. That's called exacerbation of a pre-existing condition. So when you're looking at records for an attorney, you're trying to determine, is an injury or symptom brand new and was caused directly by that accident? Was it indirectly caused by the event? Meaning the example I like to give for indirect is, you've got compression of L5 like this lady has. Now you've got, the next one, let me go to that, is numbness down the left leg with pain that increases with weight bearing. So that would be more of a direct. An indirect might be, her left leg is hurting every time she puts weight on it. So then for 3 months, and let's say this lady's 300 pounds, what is she doing? She's walking with an antalgic gait. She's putting more weight on her right side because her left leg hurts because she's got an L5 nerve compression. So now, 3 months later, she's got a knee effusion on the right side. Did the accident cause a knee effusion? Not directly, but she wouldn't have gotten that knee effusion on the right had it not been for the slip and fall that caused L5 nerve compression and numbness and pain in her left leg. So that's called an indirect injury. So you're looking for direct, indirect, or exacerbated. Yes, she had headaches before, once every 2 months. Now she's got them twice a week. So it was there before, but now it's worse. Hope that makes sense to you guys. She's also waking up 3 to 4 times at night due to pain and discomfort. She's got pain in the neck that increases when turning her head. She's unable to pick up more than 10 pounds. What might weigh more than 10 pounds? Your kid, right? You might be unable to pick up your kid and give him a hug. Back pain increases when standing for more than 15 minutes or sitting for more than 20 minutes. So how much is this going to impact her life? Imagine if this was you, if you were this client, you're just going along in life, happy as a lark. You slip and meet blood on the floor in a grocery store. You hit your head, you hurt your back. Now you've got headaches twice a week. You can't remember stuff. You've got numbness and tingling and pain in your left leg. You're waking up at night due to pain. You can't turn your head, look side to side. You can't pick up more than 10 pounds. You can't sit for very long. You can't stand for very long. The heck can you do? Right? Can anybody think of a job you can do that would be cool with this? That you could sit at a computer? Nope. Can't sit for very long. That you can stand up? Nope. Maybe manual labor? Nope. Can't do that because I can't lift more than 10 pounds. Well, use your brain? Well, I've got memory loss and headaches, right? This is so disruptive to anyone's life. So now the fun part. I'm going to ask you guys to type into the chat. You can just type a Y or an N or a yes or a no, either way. And if you must, maybe, you can ask questions. If you say maybe or possibly, I might challenge that, but you can say it. But what you're going to do is actually tell me or tell the attorney as the legal nurse consultant, was this diagnosis associated with that slip and fall? Y'all ready? Get your fingers ready to type a Y or an N. She was diagnosed with a mild concussion. Do you feel like that mild concussion was associated with the slip and fall? Oh, I missed some stuff. Myofascial atrophy from arthritis usually means warm. Yeah, I love that. Aggravation of pre-existing condition can cause changes in daily life. Acute versus chronic. Awesome. Jessica says yes. The mild concussion she believes was caused by the accident. Ada says yes. What about the rest of you guys? Type a Y or an N. Was the mild concussion associated with that slip and fall? Another thing she was diagnosed with. We'll go ahead and move on, but you guys go ahead and type the Y or the N if you can hear me and you're able to do that. Neck pain. Do you feel like her neck pain was caused by the event? Tell you what, Rob, I'm going to do this a little different with the delay. What I'm going to do, guys, just so that I don't waste your time here. Concussion, moderate with severe post-concussion syndrome. Lazarus says yes. I love those responses. I'm going to put all of them. I'm just going to change the way I do this a little bit. I'm going to put all of them on the board. And then what I want you guys to do is tell me the ones that you feel like would not be associated or that you're questioning whether it was associated with the event. So she had neck pain, lumbar pain, right shoulder pain, headaches, sleep disturbances, depression, weakness, C2, C3 disc bulge, L4, L5 disc protrusion, L5S1 disc extrusion, and a right shoulder rotator cuff tear. Which one of those are you scratching your head on going, Randy, I'm not so sure about that one? It wouldn't matter if she had a past history of migraines or headaches because now they're exacerbated from the fall. Yes, Michelle. If there's no evidence in the record that before she was having headaches twice a week and had memory loss, right? So if it was the exact same before the accident, we can't tag that with the accident. But are there any others on here that you might go, Randy, I'm not sure I could pin the slip and fall with that diagnosis? There's one in particular that I want you guys to definitely question. Sleep disturbances and depression. Yes, Jessica. Let's go ahead and get you signed up for Catalyst. Yes. And why are you, I'm just going to answer this for you. Why are you questioning those? Because what was her past medical history? Depression, right? She's on Zoloft. All of it are associated except depression because it's in her history. Yeah, Ada, exactly. Now, does that mean it's not worse? Can you imagine having all of the signs and symptoms we just went over? You have a history of depression. You're on Zoloft. Now you can't lift more than 10 pounds. You can't turn your head. You can't sleep at night. You've got migraines. Your back hurts. You can't sit. You can't stand. You can't exercise. You can't go to work. You can't snuggle your kids anymore. Is there any chance in Hades that depression is not going to get worse? Probably not. Right? So even the depression that was there before could be exacerbated by this event. And how is this going to change that client's life? I mean, we talked about this, but this is great to think of as a legal nurse. How is this impacting their life? Work? I can't think of any work they could possibly do with all those symptoms. Kids, grandkids, driving. What do you do constantly when you drive? Look left, look right, look behind you. Can't drive, can't sit for more than 15 minutes. Sleep, thing of the past. I can't sleep at night anymore. My depression, getting worse. How's that going to impact well-being and just normal life enjoyment? Physical health, ability to exercise, to take care of yourself just got a lot harder than it was before. And there's a ton of other things that you guys might be thinking, yeah, I could see how this would impact other things in her life as well. And that's great to think that way, because you're going to help the attorney understand this isn't just a CT scan. This is a person whose life has now changed because of the slip and fall, because of the meat on the floor or the blood on the floor.
Yeah.
All right.
So we're going to, obviously, one of the cool things about that exercise is just the realization that you know quite a bit, right? And that can be
Indeed
a huge benefit to you, right? As it relates to being a legal nurse. So this is what I like to do. I know that we've got this big lag, so it might be tough, but usually what I like to do is just kind of get a scale of 0 to 10, being 0, like I have 0 confidence, and 10 being like, I'm very, very confident that with the right training and mentorship, you could succeed as a legal nurse. Why don't you type that in there? After this exercise, how do you feel?
Yeah, hopefully, if you had any doubts whether you could do this before, after this exercise, you feel a lot more confident that you could actually be a successful LNC.
Yep. And just for the sake of time, we'll just kind of move forward. You can put your rating in there, but
yeah, please do though.
Yeah, absolutely do that, because we like to see that. The truth really is what Randy just said. You do have the knowledge that you need to be successful as a legal nurse. There's always going to be a gap though, right? When you're going into a new industry, there's going to be a path that you need to be able to get the necessary knowledge as it relates to becoming a legal nurse consultant. And we just happen to have that, that experience to guide you to break into the field. So it's one of those things that there's always going to be this two-prong idea here. And that's, yes, I have knowledge, but I am going into a different industry. And now I just need to be guided to use that knowledge properly. And when I do that, I can have a lot of success. So here's the reality. Our primary goal, regardless of if you choose to work as a legal nurse consultant or not, is to give you the tools that will help you change your future. And we just know that there's so much more for each of you. And we want to empower you to achieve whatever you want possible in your life. And really that starts with an understanding that there's always going to be circumstances that we just can't control, right? I talk to my kids about this a lot. I happen to have a baseball team full of kids, not quite, but similar. And one of the things that, I talk about is just that things happen, right? There's going to be circumstances that happen that are beyond your control. And the good news is that you can control your thoughts.
Hey, Rob, I'm going to break in here.
Yeah.
Only because I think that what you're talking about is literally the answer to the questions that I'm seeing in the comments.
Yeah.
I'm seeing some 7s, 10s. Lazarus says with the right guidance, he could be awesome at this. I don't disagree. And a couple people have asked, yeah, it sounds good, but I don't know how to start. Well,
Yeah.
guys, I interrupted Rob, which was really rude of me, for a point, because I want you to listen up. Because right now, right here, what we're talking about is how you start. And what you'll hear me say, and I want you to hear this. I'm not saying even Catalyst is how you start, because before Catalyst, even though this pathway is laid out for you in gold, you got to start right here where Rob is talking about right now. So I want you guys to tune in and listen to what Rob and what I'm going to take over here in a second and talk to you about how you get started down this pathway to be a successful LNC entrepreneur.
Yeah. And that really comes down to a couple of things. One is, what are the things that you're telling yourself? Do you believe that you can be successful? I don't know if I can do it. You have all these thoughts, right, that come into your mind, and you can be your worst enemy at times, right? We all can be like, oh, I don't know if I can do this. And what is that? What happens when we do that? It's gonna determine a couple of things. If they're negative thoughts, it's going to create negative feelings. If they're positive, it's going to create really, really powerful emotions and feelings. And based on that, what that's going to do is it's going to produce the actions that we take, right? We're going to then know, okay, I've got this action that I can follow. I'm just going to take the positive approach, because we talk about that a lot. The clients know that, like, our business accelerator calls are all about, figuring out ways to be abundant and have a good mindset. So those actions that we plan to follow, when we've got those feelings, good feelings, and they lead to positive actions, what's going to happen? We're going to have results that are the effect of the actions that we take. And so we're going to go a little bit deeper into kind of what that looks like in terms of the nurses that we've talked to. And we've talked to a lot of nurses. And so Randy's going to talk through, just the circumstance that we've seen and all the conversations that we've had over time.
Yeah, I love this slide. It's a very simple presentation, right? But my goodness, there's a lot in here. Yeah. And I think a lot of
a whole
us,
hour on that early.
Oh my gosh. I think a lot of us, especially maybe nurses, are worse at this, but we tell ourselves some pretty crappy stuff. And we talk down to ourselves a lot. Even if it's not like, you're fat and you're ugly. Why are we still where we are? It's the reason that we are where we are today is because of the decisions we made yesterday. And those decisions started with the thoughts in our head. So if you're thinking like that flea in the jar, right? I can't, right? I can't because I'm not smart enough. I can't because I don't have enough experience. I can't because I've got a stable job. I can't because it's not that bad. I mean, yeah, sometimes I cry in the car on the way to work or after a shift, but it's not that bad. Yeah, sure, I can't spend Christmas with my kid anymore, but it's not that bad. I can't because I don't want to invest in it. I'd rather go buy a $40,000 car that's going to depreciate instead of changing my life. And if you always are thinking, I can't, you're limiting yourself to a lifestyle that isn't reaching your full potential. Probably not the life you dreamed of. And we have to start with the thoughts we tell ourselves in order to change our emotions, to change our actions, to change our outcomes. I think it was Einstein who said, if you do the same thing over and over and expect a different result, that's the definition of insanity. Not saying you're crazy, but I've been there. Like hoping for the best and doing the same thing. You're not going to get much of a life change unless you change your life. So here's what nurse after nurse after nurse have told us with their thoughts, feelings, actions, and outcomes. And I want you guys to type into the chat if you can resonate with this. Their thoughts that they're having, I feel like I'm in a career I don't love anymore. I love helping people, but I feel stuck. That leads to feelings of frustration, anger, discontentment. They tell us they feel absent from life. Like life is passing them by and all they're doing is working, thinking about work, recovering from work, sleeping for work, stressed out from work. And that's the action it leads to. You're overworked. You lash out often at the people you love the most and you feel like you're just trying to make it through another day. The outcome, every day is a struggle, always stressed, never really relaxed. No real time for yourself and no real quality time for family or friends. Anybody feel that? Does anybody identify with that? And what we want to do, again, whether you join us in our community or not, is to provide you some clarity that you can have a better future. It doesn't have to be this way. Nurse after nurse after nurse. We have hundreds of nurses in Catalyst. They're changing their lives. Don't get stuck. And in Catalyst, what we want to do is build the confidence in you that you can do it, that you can succeed. And then we're going to give you the expertise so that you can execute. And what nurses tell us, and Andrea, Rachel, Amanda can testify to this, your thoughts change. Once you get into Catalyst, you start changing your future, that fear and anger changes into hope. And you know that you can have better. You feel empowered. You feel confident, excited. I have nurses tell me pretty often, I feel this spark inside I haven't felt in a long time, a rekindled passion that I haven't had in nursing in quite a while. The action is to follow this proven, reliable pathway that we've set out in Catalyst for that better future. And if you do, the result's going to be freedom and abundance, financial security, a better lifestyle, and a way better boss, because you'll be your own boss. So let me go back to the chat here to see if anyone has said if this resonated with them. Andrea had to jump. Why do case reviews now for casual relationship, one of the causal relationships, one of the legal nurse pointing out things? Yes, exactly. Yes, Michelle. Yes. So you probably work for an insurance company. So you already have a lot of experience. Now it can just translate out of, if you're like everyone else I've talked to in insurance companies, you're probably making $35 to $40 an hour, and you can instead make way more and have way more freedom. So how do we do this? Let me first start with the goal of Catalyst, and it's right there in the middle. Fully remote, 6 to 7 figure legal nurse consulting business. That's the goal. That's where we want to get you. And fully remote does not mean work from home. It can be home. This is my home. I work from here, but I also work from my favorite restaurant, work by the pool, work on the beach, work in the airplane, work when my wife's driving the car, if we're heading on vacation. You can work anywhere, wherever you choose. 6 figures can come pretty easy if you do what we teach. 7 figures is possible, but it's going to take some time. We're not going to blow smoke up your rear and tell you 7 figures is going to happen in 3 months. It ain't. It's hard to get there. But if that's what you want, awesome. You can get there as a legal nurse. But we focus on lifestyle design and not just more. So if what you really want, if you're like, Randy, if I could just make $250,000 a year and spend more time with my kids and take vacations and not have to worry about debt, I'd be really happy. Perfect. You can totally get there. And you guys said this in the chat already. Multiple people said this, and this is where you start. I ain't got no idea where to start. That was literally your words. I don't know where to start. Well, awesome. In Catalyst, we're going to show you exactly what to do to get started. We're going to kick off with legal lingo. So when that attorney does call you and say, hey, I've got this PI case, a UIM, and a quick SOL, and they need a fast turnaround, you'll know what he's saying. We're going to teach you the legal lingo that you need to know. We're not going to put you through law school. We're not going to spend a year trying to teach you every law, because you're not going to be a lawyer. You're going to be a legal nurse. Then we're going to show you 4 different ways to make money as a legal nurse. There's literally 4 different streams of income you can have at one time through your same job. And we're going to show you how you can do it yourself or subcontract out. Doing it yourself is pretty sweet. Make $150 an hour. Amanda and Rachel, is that what you guys charge as well? $150 an hour? Yeah. So $150 an hour is not too shabby as a legal nurse, I wouldn't say. But the real magic happens when you subcontract out. Now, when you subcontract out, what that means is I get cases. So let's say I've got 5 cases this week, which happens most weeks for us. I've got 5 cases. I'm going to sub all those cases out. I'm charging the attorney $150 an hour. I'm paying my subcontractor, who's a nurse who's come through Catalyst, learned to do the work the same way I do. I can trust that they're going to do high quality work. I'm going to pay them somewhere in the range of $40 to $60 an hour. So let's just call it 50 for simple math. I've got 5 cases, charging the attorney $150, paying my sub $50, and I'm out playing golf making $500 an hour. That's where the magic can really happen and how you can really start scaling your business. And this whole first section of teaching you what to do when you start is called LNC Essentials. And what that does, this portion of it gives you the confidence to know that you can do it, that you can be successful in it. And not only are you going to be learning and seeing how you can be successful, you're going to be surrounded with other people who are successful. So by the time you get through LNC Essentials, you're going to have way more confidence than you have today. And you say, that's great, Randy. Sounds good. But man, I have no idea how to create a high quality case review. Worry not. We're going to show you exactly how to create top tier case reviews. That includes a very simple chronology process and a top tier report writing process. And you're not just going to learn how to do it. I'm not just going to tell you how to do it or give you examples of how to do it. You're literally going to do it. You're going to learn it by doing it. You're going to get on the bicycle and ride it while you're still in the program. That's going to come in the form of 3 practice case reviews. So you'll actually download records right from Catalyst. You'll click a button, download the records. You start working through your very first chronology. At this point, you've already gone through all the lessons where I teach you how to write chronologies and reports. You download all of my templates. Everything I teach you, I give you. You don't have to recreate anything. Once you're done with half of the records on that first chronology, you click a button in Catalyst, you upload it. One of our team of experts is going to review it, and within 5 business days, send it back to you in a video with your chronology, your very first half of your chronology, right side by side with the one we turned into the attorney, and go line by line and show you everything you need to correct and do better moving forward. Then you take that and you finish your first chronology, you upload it a second time. Another individualized, personalized video review side by side with what we turned into the attorney. Then you write your very first report. Guess what? You upload that. We're going to get another personalized, individualized video review of your report side by side with ours, showing you what you need to do better on moving forward. Then you get a second and then a third practice case. And you get 3 more individualized video reviews on each one of those. So in total, you get 3 practice cases with 9 video reviews of your work, so that by the time you get done with that third practice case, you now have an amazing work product, and you know that you can get what's super important here in this section that we call case story crafting is repeat business. Repeat business is huge because we don't want you going out trying to get a new attorney every time you need a new case. You get an attorney, you blow their socks off with the work product, they keep coming back. For the better part, well, for over a year, I didn't market at all because I didn't want my business to grow. I was happy, and I kept getting referrals, and I kept getting repeat business. I didn't have to market anymore in order to keep my head above water with the business because it continued to grow even though I wasn't marketing because of my work product. So you're like, okay, Randy, this sounds good. I want to do it, but man, I'm a nurse. I'm not a business owner, and there's no guarantee of business success if I do this. I don't know what I'm doing as an entrepreneur. We're going to put you in a process that's a proven, repeatable system. We call it a business in a box. And literally, now Amanda and Rachel might disagree with this because sometimes they'll be on these calls and they'll be like, no, Randy, this number's wrong. I say 80% of the work is handed to you. I know that I've had Amanda shaking her head. Amanda, how much of the work do you think is handed to you?
Oh, probably closer to 90%, I'd say.
Yeah, I try to make this as easy as possible for you guys. Literally everything I teach you, I give you. You don't have to worry about contracts, expense tracking, invoicing, templates for your chronology, your report, your business plan is all given to you. And everything I give you, download, personalize it for yourself, and make it your own. Put your business logo on it, which we're going to help you create. And then one of the amazing things that I think outshines everything else in the program, Rob mentioned it at the beginning, is our community. You'll hear this in the YouTube videos. If you go to my YouTube channel, subscribe there, randy.loveless, you'll see tons of testimonials. And you'll see I asked them, what were the couple things that really moved the needle most for you? And almost every time, the first thing they say is a community. Our community is fantastic. And I'll let you know this right up front too. Everybody doesn't qualify for the program. I'm very selective on who I let into the program because I want you to win, and I want you to be supportive, and I want you to get support. Our community is absolutely amazing, and you've got the power of 200 other nurses doing the same thing that you're doing, helping propel you forward once you join Catalyst. And that comes in the way of communities that you can go and type and chat back and forth in, as well as live group mentorship sessions. Twice a week, we have live group mentorship sessions. One of them is focused only on the work product, helping you navigate that work product. The second is focused on entrepreneurship. And we call this whole section entrepreneurial excellence. And what this section gives you is certainty, but not just certainty that you can succeed. You will literally be succeeding as an entrepreneur while you're still in the program. You won't even have graduated the program and you'll be a successful entrepreneur. And this whole pathway is called the LNC Business Accelerator Pathway. Rob, I said a lot there, dude. You want to break it down into like high level, quick couple bullet points so that everybody gets the gist of it.
Yeah, absolutely. So when you enroll, you actually get immediate access to everything that he just talked about. It's in-depth training. One of the cool things is that the way we laid it out is like super simple. You can just go through it. It's easy to navigate. They're like, I had said this earlier, but it's not like we just hand you a binder and hello, there you go. No, they're bite-sized videos that you can watch. And then you'll have the downloads, like you said, for each of the relevant lessons. He mentioned the 2 weekly group mentoring sessions. One was about writing reports. The other one's about business topics, things like sales, productivity, mindset, communication, overcoming fears, goal setting, overcoming imposter syndrome, setting boundaries in business and life, lifestyle design. There's so much that we cover. And one of the things that Randy and I do is we invest ourselves in coaching. Mm-hmm. And that's so important, right? Because we do what we teach. And the beautiful thing about that is like all the things that we learn, we have the opportunity to share with our community. So it's just phenomenal that you have the opportunity to be able to participate in all of that, especially knowing that, I myself have personally invested well over $250,000 in coaching and training and different things like that. So try to impart the wisdom that we have there. And then the other thing is all our calls are recorded, so you can watch them if you attend them live. In fact, we even have a section that you can ask a question, and we make those questions a priority. So if you can't attend, you can watch the replay and see that your question is answered. Randy also put up that there's private Catalyst communities. There's Subcontractor Connect, Entrepreneurs Connect. There's a Celebrate Your Success, because we love to see that. And then there's practice case Q&A communities. So that's everything that you get within the program.
Yeah. And I would say that I always recommend when you join, if you join today, one of the first things I would say to do after you do your onboarding checklist and the welcome is to start watching some of those pre-recorded, those previous weeks of the group mentorship sessions. It can be huge to help you dive in and really get an understanding of what this is very quickly and get to know the community. And that's Rob, you and I are saying how great the community is, but I think the proof's more in the pudding of what our clients are saying. Yeah. So let's go over some of those comments.
Yeah, for sure. And just some context around this too, that's important, is we have feedback forms in each of the modules so that we ask like, hey, what did you like best? What are things that, could be improved? And so a lot of what is being said here is coming from those feedback forms. If you want more in-depth case studies and interviews and things like that, you can always look at the YouTube channel, because there's a lot of them there and they're phenomenal. So let's just take a look at one of these. Let's see. I like this top left one just because I feel like a lot of people can relate. I've been very nervous about this entire thing, thinking that I would be overwhelmed. However, this is easing my nerves, and it isn't going to be as difficult as I thought. I love that just because, who doesn't have some nerves when they first start something new?
Absolutely. Yeah. The next slide here has some on it. And the one I like here is kind of like it in the bottom right. I learned so much. None of this is in my wheelhouse. Guys, it ain't in your wheelhouse. Like you have your nursing and you saw in the case walkthrough, you can do this, but you're not sure how to be a legal nurse yet. And trust me, Amanda, Rachel, you guys, did you feel like when you first started that being a legal nurse was in your wheelhouse, that you had this in the bag? No. But yet today, they are both running very successful LNC firms because we're going to teach you everything you need so it becomes your wheelhouse.
That's right. This next one, I like how Randy keeps these lessons very concise, no fluff, just great content. Simple as that.
Yeah, I don't want to waste time. Just get you what you need. It's not all about giving you tons of content you can't use. And then, of course, bottom right again, my new favorite quote. Apparently, I said this at some point. You will always find a way to fail if you're always seeing failure. And I completely stand by that. Because this is a couple things we say. Rob says it a little different than I do. And I don't know that I don't like Rob's more. I like to say you go where you look. And if you're always looking at reasons you can't, you won't. Right? If you aim for nothing, you'll hit it every time. If all you're seeing is failure, it's kind of like that flea again, hitting that screen. If all you see is the reasons that you can't, then you won't. And guess what? If you don't do something different, you will continue to get the same things that you've gotten, just like we talked about in the beginning. If you only see failure, you're going to be guaranteed to fail. Rob says it in a different way. He says that what you focus on expands. I like that. Maybe even more. Because if you're only focused on failure, you're going to see failure everywhere. If you're only focused on why you can't take your next step to change your future, that's going to be the barrier that stops you from doing it. It's going to be the barrier that keeps you where you are. So, question, how much can you make as a legal nurse? I've already spilled the beans on this. I charge $150 an hour. The other girls on here said that they do as well, our clients that are on this call. So if you think the average case might yield about $2,500, you literally get one case a week and you're making $10K a month. Now, sometimes the question comes up, and Rob, I can't see the chat, so tell me if you see any questions. Sometimes it comes up like, how much does the average case? I'm just going to put that out there right now. Who knows? It would have to be, you'd have to average your own over time. It really, really depends. I'm going to show you a multitude of different type of service offerings, different work products that you can create for your attorney. If an attorney gives you 60 pages of medical records and you're going to do a merit review, that's going to be way smaller of a time commitment and way smaller of a paycheck than if they give you 10,000 pages and want a full Cronin report. We've had paychecks of $20,000 for one case, and we've had paychecks of a few $100. So it really just depends. But if your average is about 2,500, one case a week is $10K a month. And something to know about the business of legal nurse consulting, you have very high profit margins. Now, if you're not familiar with profit margins, if you were to go and start a corner restaurant, you've got expiring equipment, you've got expiring supplies, you've got expiring food, you've got supply chain issues, you've got AC, lights, employees. There's so much overhead. It takes so much to run the business that if you make $1 million, you might only bring home 80,000. In legal nursing, that's not the case. You put a lot more of the money in your pocket because you don't have a lot of overhead. You'll literally spend maybe a few $100 after you're in it and up and running for the software to be able to send contracts, to do your marketing, to send invoices for Adobe Pro. You might spend a few $100 a month. All the rest of that money goes right into your pocket. So your profit margins can be 90% plus.
Yeah. I just wanted to add a couple things here, Randy, because I think it's important from a business mindset, is that the $150 an hour overtime, right? This is because I always look at business as stages, right? You have a kind of a initial spurt where you're just like grinding and you're working hard. But as you grow your business, you can scale. That $150 an hour actually ends up becoming a lot bigger than that because of the potential of subcontracting. So if you had like 4 or 5 subcontractors out there doing work and let's just say you're paying them $50 an hour, and you had those subcontractors working simultaneously on cases, how much are you really making? Are you making 150 or are you making 400 an hour? Right. So it just kind of depends, but you can build that as you grow and you scale your business. That's what's possible. And I always like to look at the potential and the power of leverage. And so that's one of the beautiful things about this model as well. Now we're going to talk. Go ahead.
I want to quickly ask you guys, after seeing what we offer and kind of getting to know me and Rob and Amanda and Rachel and Andrea a little bit, if you had to rate the old nursing scale 1 to 10, how confident are you at this point that if you wanted to do legal nursing and you decided to join Catalyst could get you where you want to go? That if you join Catalyst and do what we teach, you'll reach your goals. 10 being, I'm supremely confident if I do this, Randy, I'm going to be successful. And 1 being, I should have logged off long ago. Where would you be right now? Just type your number into the chat for me.
You know, the delay is so bad on some of them where I saw some people's stuff come in from like 10 minutes ago.
Yeah. Telling me like which diagnoses they wouldn't. Yeah.
It's like, oh,
that too. It's a pretty bad delay.
But
while you're typing your number in, oh, great, Jessica. That's awesome. The 9 is great. While you're, go ahead and type your number in 1 to 10. And while you're doing that, I'm going to ask Rob if he will go over something with you because, guys, like I said, we're very transparent and we're not the only legal nurse training program out there. There are others. And while I feel like we don't have any competition because no one's doing it the way we're doing it, no one walks with you, there are others out there. Rob, go over what some of these programs are actually charging for their services.
Yeah, just up front, we're not making these numbers up. These all come from actual programs and from a lot of the nurses that we've talked to on our enrollment calls. This happens all the time where people will be like, oh, well, this person was charging $15,000. This one was charging $17,000. There's another program that's $25,000, and they say that you can be a business owner and be successful in 6 weeks.
Make $1 million.
14 weeks, which is crazy, right? And some of our clients have even spent upwards of $35,000 seeking proper LNC training and education elsewhere. This kind of like really bothers us because, you know, you can eliminate a lot of that pain. Now, I will say this, that I have invested way, way, way more than even that $35,000 number. And I can tell you that it was worth every penny. Why? It was because of the action that I took and I was able to see business grow and scale. And so it's not necessarily the number, it's your attitude toward the investment that you make. But at the end of the day, we're trying to make this accessible and also understand that with anything that is worth anything, you're going to have investment and there's going to be, and I would even say that there's even some, you know, sacrifice that needs to be made in terms of like uncomfort. Like that usually happens, like, and that uncomfort can come in different ways, not necessarily money, but in other ways. But yeah, those are kind of the ranges that we see out there.
Yeah. And we have nurses in Catalyst right now who have come from every other program out there. They've taken these programs, spent $15,000 to $25,000 on them, didn't get what they needed to be successful. And now they're just more broke and coming to us. And then they join us. And I'm happy to say that every one of them that has walked through and done what we taught them started a successful LNC firm. So don't waste your money. If you're going to do something, make sure to do it right the first time.
And Lazarus, appreciate you, man. That's kind of you to say that.
So what is the investment with Catalyst? Well, I'm excited about this because Rob and I talked about it, and we're giving some like special bonuses to you guys and stuff that we really don't give out. Kind of never before done stuff. So
Amanda and Rachel are going to be a little bit like, oh my God.
Don't listen, Amanda and Rachel. La 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 la. We got some special stuff for you guys through Nursepreneurs. To be honest, we haven't done a Nursepreneurs webinar in a little bit. So we said, let's really take care of the people who want to join today. So Business Accelerator, everything that I talked about before with LNC Essentials, case story crafting, the 3 practice cases, the 9 reviews, all the business side of it, the live group mentorship sessions, the communities, everything. You get 12 months of access. So this is not a 14-week program. This is a year that you have this community, this mentorship, that you have exactly what you need to be able to move through this at your own speed to be a successful legal nurse by this time next year. Most people in 6 months, 7 months, you'll be getting your own clients as an attorney, as a legal nurse consultant, getting your own attorney clients. But you've got 12 months to do it. And the cool thing about Catalyst, when Rob and I first started this program, we knew this is going to be better than anything else out there. And it is 100%. I have no doubt this program is head and shoulders above everything else out there. We knew we could charge more because it would be worth it. And if you paid $35,000 for this program, it would be worth it because it would change your life. And how much is it worth to be able to be a mom or a dad or to take vacation or to keep your mental health? How much is it worth to spend Christmas with your family, right? You can't even put a price tag on it. But we really didn't have that conversation for very long because we knew that our focus was not making money. It was changing lives. So we wanted to make it at a price point, an investment level that more people could do. That we never want the financial portion to be the reason you don't take the steps to change your life. So instead of $25,000 or even $15,000, we're less. You actually get the full 12 months, everything we talked about, for $12,000, and that can be broken into installments. Or this is where the fun part comes in. For this workshop only, you can make a full pay, one payment, $99.97, save over $2,000 on the investment, and get in for under $10K. And that's not all. Rob's got more for you.
Oh man, here we go. I almost feel like an infomercial here, but
but wait, there's more. I know, but we did. We put in a lot of bonuses here.
Yeah, absolutely. And this is a special thing. We just don't do this often. I actually saw Rachel's eyes kind of widen a little bit.
Sorry, Rachel.
The bonus here is, as a thank you for joining the workshop, we are also giving you an additional 2 months of access completely free when you get started. The other thing is we have another bonus, and this is for this workshop only. You'll also get 3 free one-on-one coaching sessions, which is one of our team members, which is also pretty awesome. And then also we have, of course, the painful investment at an all-time low for the $997. The 2 free months and the 3 coaching sessions and the one-time investment of $997 are only available if you book a call today. Doesn't mean you have to have the call today, just means you need to book the call today. You can still join after today, but you'll just lose access to the workshop bonuses, only bonuses. And then we want you to obviously make a very comfortable, confident investment decision. And so it's really important for us that you're in all the way, right? And you're like, hey, I want to change my life, because that's what this is about. It honestly isn't even about the program. The program is a vehicle to get you to the lifestyle that you want. That's really what it comes down to. It's just a matter of like, here's the truth of it. It's proven. We know it works. There's like zero doubt. It's just a matter of you following what we teach and coming to us with your questions and getting the support that you need.
Yeah, absolutely. And Rob, do you or Aaron know, can you guys put the link to book a call? I believe there's some way to put it in a banner, or maybe we can throw it into chat. So all you have to do is click the link and book the call. So what will happen next, guys, is you book a call using that link either in the chat or the banner. I'm not that familiar with stream, whatever it's called, not Streamflow. What's it called, Rob?
StreamYard, I think.
StreamYard, yeah. I'm not that familiar with it, so forgive me. And when we do this on Zoom, we just throw it into the chat. But please go ahead, either you, Rob, or Era, and put that up there so that they can click that link. Now, Rob mentioned this. Your call doesn't have to be today, but book it today, and that will tell us when you book it using that link today that you booked, and you get all of the benefits and bonuses of being here at this workshop. And then I don't know that you can private message, Rob, so let's just skip that one.
Well, I just put it in there just in case to put it in a comment.
Okay.
But it's in 2 places now. There's one on the screen there, and then there's also one in the comment section there.
Perfect. So click that link and book your call. Book it today. It doesn't have to happen today. Once you're on that call, you can make your payment there. We'll figure out whether you need to do installments or if you want to take advantage of that amazing deal with the one-time price of $99.97. Either way, you'll get your free 3 free coaching, one-on-one coaching sessions. You still get the 2 free months. But that price for the one-time payment is pretty smoking. Then on that call, you'll sign an agreement. You'll get a welcome email. Our team member, our enrollment member will keep you on the call to make sure you get into the actual platform. You'll get instant access to everything there and can dive in immediately. And you'll be a part of the Catalyst community for the next 14 months with your 2 free months.
That's right.
So my question to you, what other information do you need to make your decision to move forward, to take your first step, and to change your life?
Yeah, let's look at some of the comments here. See, Lazarus asks, can you scale this to 8 figures? It's not that important, but it lets me gauge. I don't ever put a limit on anything. The truth is if you had the team that's big enough and you had the systems and processes necessary to allow you to do it, of course you can, because you're not restricted by really anything other than your own mind. And so I can just tell you this personally, I have never scaled a business to 8 figures. I have absolutely been a part of scaling 2 businesses to 7 figures though. And even multiple 7 figures. So it absolutely just the principles. If you apply those principles, it doesn't matter really. With this, I will say with this business specifically, it's because of the overhead and the lack thereof. It's pretty amazing from that standpoint. That model is just pretty incredible. So it's more about, hey, work really, really hard at first to get established, and at that point, you have the opportunity to really systematize, build team and things like that. I love that stuff. It's my jam. You could ask questions on PA and just geek out on that stuff. But we always just start where we are, work really hard, and then you have the opportunity to grow as you get experience.
And I love Lazarus. I know that Michelle says she's in New Jersey and you're Wisconsin, but dude, you guys wouldn't believe how often this happens where we were actually just talking about this on one of our team calls, that it's so funny the way we don't have like cohorts you can join anytime, but people who start around the same time will oftentimes kind of get together and encourage each other as they move through the program. And a lot of times you'll see them like, we'll have a slew of people finishing up their 3rd practice case, at which point you can start taking subcontract cases if you so choose. And you've got business owners feeding subcontract cases to you through Catalyst while you're building your business. And then eventually you're going to build your business, start scaling your business. And now you're using subcontractors coming out of that 3rd practice case. And so often we see 2, 3, 4, 5 people at a time come through kind of as a team because they've connected and networked together and become friends as they went through the program together. I know Amanda had that experience for sure. You and Sarah, right?
Healthy competition. Healthy competition.
Jessica, yes, you can do it as a side gig. How long does it take to get a report together for a lawyer? Yeah, so absolutely. First question, can you do it as a side gig? Yes, you can do it as a side gig. On your enrollment call, we'll talk more about this for you individually, but as a side gig, it's basically taking the place of like your overtime shift, right? Or you want to go down to part-time at the work at the JOB, as I call it, which stands for just over broke, so that you can do some legal nursing on the side. As a subcontractor, you'll make in the range of 40 to 60 bucks an hour, which is decent money and probably more than a lot of us are making at the bedside. There's a couple of things I don't like about subcontracting only, and especially on the side. It can be great. Here's the good things about it. Number one, you get full freedom and flexibility to work when you want, where you want, and only take cases you want. You can still work in your pajamas. You can still work by the pool, and you can make money while doing that. Another advantage is you can make as much or possibly more than you would make in the hospital. That's cool. What I don't like about it is that you only make $1 if you work a minute, right? You don't make money when you're playing golf. You don't make money when you're gardening. You don't make money while you're at your kid's baseball game. And I like that idea of making money while I sleep. And you can't do that as a sub because you don't make money unless you're working on that case. You're literally paid by the hour versus what Rob was just talking about, how you can sub out 5 cases and make $500 an hour while 5 nurses are doing the work for you. That's called entrepreneurship. That's what I like, but not everybody does. The other thing I would warn about doing it as a side gig, I know that's kind of a buzzword and a lot of nurses talk about doing it. It can make it less enjoyable because I'm so freaking tired after working 3 12-hour shifts or 4 12-hour shifts this week. I really just want to spend time with my family. I'd like to get some sleep. The house is a mess. I need to go out and do something in the yard. And now I've got to sit down with this darn case and do a chronology and report. And it can make it less enjoyable. It's so much more enjoyable when it is your job. Now, you don't have to do it as your job, but when that is your job, when you design your entire life and then put work in when you want to work, it makes it so much more nice, so much more enjoyable. But most people start out doing it as a side gig, even in Catalyst, because you'll come through LNC Essentials. You do your 3 practice cases in case story crafting. You'll start subbing. Don't quit your job yet. Most people will start doing it on the side while they're working a job, taking a case here and there, and standing up their business. And then at some point, when you get your business up and running, you either pull back or quit your work. And usually not long after that, you stop taking subcontract cases. Because why would you make 50 an hour if you can make 150? And why would you make 150 if you can sub out and make 400 or 500? So that's sort of the progression.
Yep.
And then as far as how long does it take? Totally depends. Like I was saying before, there's different work products I'm going to teach you about: merit reviews, demand letters, brief summaries, basic chronologies, full crons. If I've got 60 pages of records and they ask me to do a merit review, and bang that out in an hour. So it's not going to cost that much. I'm not going to make that much. But if I've got a 10, 15, 20,000 pages of records and they want a full chron and report, and I'm getting a $30,000 to $40,000 payday on one case, and I'm going to be working on that case for 3 or 4 months, that's a big difference, right? So it really just depends on the case and what the work product is they're looking for. But I'll teach you all of that and how to give cost estimates and time estimates inside the program.
That's right.
What other questions do you need to have answered in order to get you at that 10? So that where I want you guys to get is to answer, I want you to answer 3 questions. 1, do I want to be a legal nurse? And if you have questions about that, ask them in the chat if you're not sure. 2, am I ready to change my life? Is now the right time for me to do something, or am I going to keep doing what I'm doing and keep getting what I'm getting? And 3, is Catalyst the right pathway? Do I have 9 out of 10 or 10 out of 10 confidence that if I do what Catalyst is teaching, what Randy's mentoring me to do, I'm going to get where I want to go? And if you have any questions about any of those 3, put it in the chat and let's address those. Because if all those line up, don't let grass grow. Book the call, because we can talk. If it's the financial piece, we can work that out. I will get on your call personally and try to work it out with you if you need that. I don't ever want the investment to be the reason you don't do it. And the investment's lower than it's ever been. Sorry, Amanda and Rachel.
Yeah. And just make sure that it doesn't look like, I don't know if you can just click on it, the calendar link, but if you have to just copy and paste that into your browser, make sure you do that so you can book the call. We want you to take advantage of the bonuses that we were offering today.
Yeah. It looks like you can highlight it and then you can right click and go right to it. You can do the link, or you can copy and paste it from the link that's in the chat.
Yep.
So I have no idea how many people are still on here. I can't see how many of you guys are here still, just with the layout of StreamYard. But what other questions do you have that we can answer to help you make the decision to move forward, take the first steps, and change your life? Or any other questions that you have for us. You've got me, you've got Rob, you've got Rachel and Amanda from the program. If you have questions for them, I'll cover my ears so they can answer. All right, Lazarus. Awesome. I'm really looking forward to meeting you, dude. I can't wait to introduce you to everyone else in the community.
That's right.
Jessica, Michelle, you guys have been pretty active in the chat. There was another Ada, I think was her name. I'm looking up here. Yeah, Ada. I don't know if I'm saying your name right or not. And then what was her name? Tina was active in the beginning.
Yep.
Do you guys have questions? What do you need to know to help you change your life? Awesome. Ada, I'm hoping that you booked that call already and we get a chance to chat with you. Okay. Well, Rob,
Yeah,
can't
I think
you can't see how many people are still with us, so I don't know when to be like,
I know.
I don't want to end before a question comes through, but I also don't want to belabor this.
That's right. Yeah. Tough to tell because there could be questions after we leave because of the lag.
Yeah.
Let's see.
So the training that we do is independent of Nursepreneurs, but we're the only legal nurse consultant training platform that Nursepreneurs and Katie endorses.
Yep.
Oh, you can see that, Laz? I don't know how you see that.
Yeah, it looks like there's 8 people still, 7 people now. Yeah. So what other questions do we have? Because we don't want to leave this workshop until others have had a chance.
Thanks for a big plus for stating that. Yes. Thank you for all the info, just researching, not sure I'm ready to take the plunge, need time to figure it out. Jessica, I highly recommend if you are in that mindset, check out my YouTube. I would really recommend click the dang link so that you can get all the bonuses, because those bonuses will not be available if you book later, and they may never be available again. This might be the one-time chance you get to have 3 free one-on-one coaching sessions, to get the 2 free months, to get the smoking deal of $99.97 for the whole thing. Here's what I recommend, Jessica. If you're kind of on the fence, book a call, book it for a few days out, go to YouTube, Randy.Loveless, subscribe to my channel, learn as much as you can through that, and go research others too. There's some other programs out there. Go check them out. Don't get the nickel and dime joke that one of them offers, like, you can get this one for $287 and that one for $397. I've done the math. I've gone through and added up everything they offer, and it comes out to like $19,000 if you get everything they have to offer, but they'll nickel and dime you. And regardless, what you're not going to get anywhere else is me, is Rob, is Amanda, is Rachel, is a community, is true mentorship.
Yep.
If you want a textbook and you want to be a number, there's other places to go. If you want true mentorship and life change, that's where we are. But you have to believe that. So that's what I recommend. Use the link here to book so that you get all the bonuses. Jump on a call with us. You don't have to join if you don't want to, but by that point, you will have gone through the YouTube. You will have researched me, snoop the crap out of me. I'm fine with that. Go, Google me as much as you want to. I have nothing to hide. Google the owners and the mentors that are over these other programs as well, and then weigh it. By the time you get on a call with my team, you'll have a really good idea whether you want to do it or not. And you get the bonuses if you decide to sign up.
And in terms of payment options, the reason we don't say that on here is because literally it depends based on different situations, kind of where you're at. Like Randy had mentioned, there is a subcontracting path.
Mm-hmm.
We're always going to, encourage you to do the LNC Business Accelerator. And that's because it has the most opportunity for you to capitalize on leverage and your earning potential and even freedom potential. So that's why we highly recommend that, because you just have a lot of opportunity to grow the most, I believe, and, be a true business owner and all the beautiful things that come with that, and the growth opportunities, because there are a lot of growth opportunities as well. But that's what helps you be in a position where you can reach goals you never thought possible. Right. So, and it just so happens that you have people that have been there, done that, in terms of like even the struggle and like, avoiding a lot of the mistakes that you could make if you don't. I will just say, just piggybacking off of what Randy said, I don't think there is anyone or anything out there like it, because number one, I don't think there's someone that's someone from the outside that is coming into this industry that sees things differently than maybe those that have just run legal nurse consulting businesses as well. So I think there's just a lot of opportunity for you to grow and learn. And
to answer as far as the payment options, dude, we literally try to customize it and work with you to meet you where you are. And again, I never want the financial reason to be the reason you don't take steps to change your future. So we're going to do everything we can. Does it work all the time? Can we always work something out? No. I mean, if you've got $50 in your bank account and no credit cards, there's times when it can't. But we're going to do everything we can to make sure that the financial piece is not what stops you from changing your future.
Yeah.
Yeah, Michelle, you knocked this out of the park, girl. You're already doing it. Why not have the freedom, the flexibility, the money that comes along with it?
That's right.
What's the average or below average result that one gets when starting medical consulting business, whether small or large? So a legal nurse consulting business is what we're going to teach you. Gosh, dude, it's so dependent on the person and their goals. Average, I mean, it's hard to say because it depends on your goals. I mean, there's literally like Rachel Holloway, not Tolan. Her whole point was she wanted to be able to make enough money to support her family. And then when she went out on maternity leave, she could work or not work. She just had another baby. She's just starting to get back in the swing of things. She got some cases while she was out on maternity. She subbed them out. Her goals were way different than, say, like Seth, who's just like, cases, I want cases, I want cases, I want money, I want to grow this thing. And it just depends. I mean, Amanda and Rachel Tolan, you guys probably had some different goals. So what's the average? The average is being able to meet your lifestyle design, to create that and then reach your goals.
Yeah. You just can't really just confine it to one thing, right? There's too many factors. Everyone's different in what their goals are.
Can you just work for attorneys and do the case reviews? So that's business ownership. If you're working for the attorney, well, you're not working for them, you're working with them. They're not above you. You're a business owner. You're an entrepreneur working with another entrepreneur. They own a law firm. You own a legal nurse consulting firm, and you guys work together. You collaborate on cases, and that's exactly what we teach. Lazarus says someone's a single mom, 10 hours a week to work her butt off, really wants it, knows nothing about it. That's normal, dude. Most people in Catalyst are able to put 10 to 20 hours a week into the lessons and the training to learn how to change your life. Most people haven't quit their job and can put 40 hours a week. We've had that where people weren't working when they started and literally within 2 months had stood up their business, and within 3 months getting cases of their own and are crushing it as business owners. But most people are somewhere in the 10 to 20 hours per week that they do this on the side while they're working full time, have family, whatever. It's kind of like going to college, except way more fun and interactive. And if you do that, then typically in that, like, let's say 15 hours a week, then usually within 6 to 7 months, you've gone through all of the LNC essentials, all of case story crafting, started subbing, learned to stand up your business. And usually within that 7 month period, you're getting your own attorney clients charging that $150 an hour. I had a 6-figure nursing job, didn't know. So even this is costly for me now. Yeah, I think what you're saying, I
think she had a job that was making 6 figures, doesn't now. So
yeah,
this is costly. And the thing I would have to say about that is, what are you going to do? What's your plan to move forward? Because everything costs something, right? Whether it's your time, trying to find another job that maybe won't be around because you get let go of that, or whatever the case is. Look at it from the perspective of, what's it going to cost you if you don't do something different than what you've done? Because there's a lot of people, I'll just tell you this, I've been an entrepreneur for most of my life, and I've had a lot of people tell me, "Oh, you should go get a real job," and I've had people say that to me, and I'm like, or go get a secure job. It's like nothing is secure. Like if you go get a job, that doesn't mean that you're gonna have that job in 2 weeks from now or a month from now, right? So it depends. But entrepreneurship, obviously, there's some challenges with it, but there's also great opportunity. And you are your own boss. You can control the actions that you take and the opportunities that you have. So I just kind of look at it from that perspective: is what are you going to do in place of, like, if legal nurse consulting is what you want to do, and that's your goal, I don't know, but if it is, then I would think about what can I do to make it happen.
Yep.
And instead of like looking at a cost, look at like what can I gain from it? What kind of return can I get from it?
Yeah. How important is it to you? Like if
Yeah.
your goal is to spend more time with your kids or to take more vacations or to be more financially secure, how important is that to you? How much is it worth? And if you have confidence in the pathway, put the work in, change your life, be in a different spot a year from now. And Lazarus, to answer your question, could that woman make an extra 50 to 75 a year? 100%. If you're making $150 an hour, that's in the range of 6 to 10 hours a week of work to get $50 to $75,000 a year. So yeah, totally possible to do that.
Yeah, and he's right. Like the reality is like when you think about other investments that you've made, and I'm calling it an investment, not a cost. Look at nursing degrees. How much did you spend to get your nursing license? Like that's going to vary dramatically from where you are, but and what kind of return on investment have you had there, right? So you got to look at equal things and determine like, oh, okay, this is what I've spent, and these are the opportunities I have in front of me.
Yeah. I'm glad you have gotten a lot out of this, man. I'm looking forward to meeting you.
A bit.
Any other questions, comments, thoughts? Do you want to ask Rachel and Amanda questions? Drill them about their experience as nurses who have been through it.
Yeah, I don't bite. I'm actually working outside today because I wanted to get out of my office. It's gorgeous. And so that's why I've got a change of scenery today. So.
Yeah. Amanda, what's your thoughts to somebody who might be sort of on the fence here and not sure if they should do it? I mean, you've been on that fence.
Well, it just depends on what your goals are. Where do you want to be in a year? Are you happy being where you're at? Is that where, if you woke up and was in the same spot a year from now, would you be satisfied with your life? Or if you woke up a year from now and you were running a successful legal nurse consulting business where you could work whenever, however much you wanted and be your own boss, what would give you the most fulfillment?
Yeah. And Amanda, you started the year off pretty strong, if I remember right, with cases, right?
Oh, it was a busy year. It was a busy year. Oh gosh, I don't even know what I'm at right now. I should probably look at that.
I talked to her like March and she had like 30 cases or something under her belt for the year. It was pretty crazy.
Oh, I'm past 50 now, I'm pretty sure.
That's awesome. And Rachel, what's your thoughts for someone who might be on the fence? You felt what they're feeling, the fear, the trepidation,
Yeah, I mean, I'm definitely newer into it than Amanda, and I say all the time, I wish that I could go back and just whisper in my ear in October when I started and just say, like, it's scary, but take the leap. It's worth it. I stood up my business in January. So what is that, 5 months ago? And I've got 3 attorney clients already. And I actually am dropping back to part-time as of next week at my JOB with the plan in 6 months to quit completely. So
yeah,
just do it.
I love it.
Yeah, the other thing to think about is like, it's not, it's different also because you could have 10 attorneys and do very, very, very well.
Oh my gosh. Yeah. 5 attorneys, you could do really well.
Right. It's because it's about that repeat business, about, the opportunity to continue to do case after case with multiple attorneys.
Michelle, to answer your question, if you want to do the reviews but not deal with the other stuff, yeah, that's just subcontracting. You can totally do that. In fact, you can do it if you join the Business Accelerator pathway and you get to the point you've done your 3 practice cases, somewhere in the 3 to 6 months from now range, you've done your 3 practice cases and you're subcontracting. You can do that as long as you want to.
Mm-hmm.
And when you're ready and you go, okay, you know what? I'm kind of tired of watching everybody else making all this money and getting all these attorneys, and I'm making 50 an hour still. I want to start my own business. So then you take the steps. You start you start with your business plan. We teach you how to create a logo and a brand, and you start learning how to market. When you're ready to pull the trigger, you market. Usually within 1 to 4 weeks of starting to market, you'll get your own attorney client. Then you're doing the same work that you were doing as a sub, but now you're making 150 an hour for doing it instead of doing it for 40 to 60. That's what most people want to do.
I'll offer too. I do subcontract. I have my own attorney clients, but I have a couple LNCs that I subcontract for consistently. I do 2 to 3 cases with them. So the subcontracting piece is really nice to get that going when you're standing up your business. So there's an immediate return on investment.
Lazarus says, can we train her to be a superstar? He'll pay for the class. Split it up in payments for her. We'll partner up. Laz, if she joins the program, we will train her to be a superstar.
That's right. Absolutely.
Oh my
And Amanda,
God.
you did that for the first year. It's like you did a lot of subcontracting work while you were doing marketing and getting attorney clients as well. So you're a great example of that as well.
Well, yeah. Well, even from the beginning, though, I told Randy, I was like, I don't want to be a business owner. I think I'll just stick with subcontracting. Like literally, that's what I said to him. And you do get tired of making pennies when you could be making hundreds, right? Like it just doesn't make any sense. So they're literally taking your work, putting their name on it, and sending it to the attorneys. So why wouldn't you just cut out the middle person and take that for yourself? So the income potential is much, and the flexibility that comes along with that is much more exponential. So yes, I can totally relate to what you're saying. You learn how to do it. You learn how to do it. It's not as hard as it seems. Being a business owner is not as complicated as it sounds. They teach you everything that you need to know. We all will have the same questions and concerns, and we'll reach out and then just ask your questions, and we'll walk you through it.
That's right. Yep. And Michelle, I thank you for sharing that. She said she was let go after 22 years of off position. And I've heard that way too much. We have this false sense of security in JOBs. They can let you go at any time, and they'll have you replaced tomorrow. A lot of us have experienced that. In fact, Andrea, who was on here before, she was I think she was a CNO, COO, something. She was an executive, and they dissolved her position and just let her go. Michelle, I highly recommend you click that link, put that link in right now and book a call. If you don't book the call today, you don't have to have your call today, but if you don't book the call today, then you won't get all of the bonuses. And if you think there's a chance you'll want to do this, just book your call for later in the week. Book a call for Thursday or Friday instead of booking it for today, but use the link that we gave you right here to book that call so that you can get all the freebies, because those won't be available if you decide next week you want to do this. And you can still go to our website, catalystcoachingandmentoring.com. You can go to my YouTube channel, randy.loveless. You can go to Facebook or Instagram. You can book a call anytime you want, but you won't get all the freebies. The price, the investment portion for pay in full will go up to our normal amount. The one-on-one coaching sessions will be gone. The free month's gone. So I highly encourage you, if you think you might want to do this, fine, do your research. Just schedule your call for a few days away. Do all the research you want. Snoop, talk to other programs if you want to. I don't care. Make the decision that's right for you, but don't lose the bonuses.
Yeah, exactly. It's like no reason to do that. Just book the call, and then you have that option at least.
Oh yeah, I snooped on Randy big time before I signed up. So do it.
Stalker.
I did.
Same.
LinkedIn, YouTube, Facebook. You can find him. He exists.
I booked a call and did the call and then got off the call and booked another call because I wanted time in between to do all my research. So yeah.
Do the research on the front end.
Yep. Do the research on the front end and the 3 one-on-one coaching sessions. That's amazing.
Yeah.
I know. Like a lot, like
Don't
sometimes
be jealous. Don't be jelly.
We weren't that special. We didn't get that.
Fine. Everything's fine.
Fine.
Why is your face turning red then? It's funny.
Yeah, Michelle, totally. Working from home is nice. One of the things I've heard about people who work from home for like insurance companies, I don't know how yours is, but a lot of them are like, they literally are monitoring your keystrokes and you still have to like run to the bathroom so they don't know you're away. They're buying the little things that move the mouse. So they think you're like, oh my gosh, what a joke. You still have to ask off for holidays. You still, can't just go at 2:00. I'm actually going to my little, my 12-year-old girl's got an award ceremony at school today. Guess who's going to be there? This guy and my wife. Oh, did Rob just leave? I think he just accidentally left. That's so funny. But yeah, working from home's cool, but working fully remote and being your own boss and designing your own life and not working so hard so other people can make a lot of money and not you, that's even better. All right, what else do you guys have? Questions? What do you need? Tell us. Please, please, please. Go to that link that's on the screen. Oh, I bet that's Rob. Yeah, there's Rob. I'm like, Rob just accidentally logged off of it. Please book that call using the link here. Don't lose the bonuses. I would hate that for you guys. I would love for you to join, but my gosh, I mean, we're not winning anything by you joining with that link. You are, so why not do it? Ada says, Amanda and Rachel, how long have you been doing this? So Amanda, you want to go first and kind of tell them how long you've been doing this and where you are?
Yeah, so I joined Catalyst in the end of March of last year. I started my business in July, and then I really went off and running around September is when I transitioned from a working PRN, having kiddos, to full-time LNC subcontracting and getting my own attorney clients. That was kind of, so my business is still a baby. It hasn't even existed for a year yet.
And you said over 50 cases, you said?
For the year, yeah. It's been
for this year, yeah.
Just 2025. That's not 2024.
Yeah, that's pretty amazing. And then Rachel?
I started October of 24 in the program and stood up my business and started marketing in January of this year, January 27th to be exact.
But who's keeping score? Who knows?
I remember that day. And then it took about probably 4 weeks of marketing the way you learn in the program. And I had 3 attorney clients of my own. And I was subcontracting within, I think, like 10 days of being done with the program, 10 days, 2 weeks. So I was subcontracting at the same time I was standing up my business. So mine is a very tiny little baby, just 5 months old. And I'm already working on leaving the JOB, which is really exciting because like Randy said, when you start working for yourself and you're making your own money, and then you look at the mathematics of what you're getting paid by your job and the time and hours that you put into it and all the things, it's just, sometimes you wonder why you're doing it.
Yeah.
So
yeah, and the results that Amanda and Rachel have had are not atypical in Catalyst. I will tell you, if you don't go through Catalyst, I wish you luck. I really do. I hope that you figure it out. But there are a lot of struggling legal nurses out there that can't find work. They can't find attorneys. They don't know how to market. They don't have a good work product. So when they do get an attorney, the attorneys don't use them ever again. They can't find good subs to scale their business. None of those are a problem in Catalyst. And what these guys have experienced is very typical in Catalyst. What else y'all got? What other questions, comments, concerns? What do you need to hear to click that link, to put that link in there and book a call with us? Anybody? Okay.
I think we might be at that time, Randy.
I think we're at that time, Robbie.
Yep.
All right. Well, hearing no more questions, guys, thank y'all so much. Ada, I'm excited to meet you. I can't wait to welcome you into the community. Lazarus, I can't wait to welcome you in. Michelle, I'm not sure where Tina went. Who else was it that was saying they were going to book a call? Jessica, guys, I'm really excited to meet you. Please don't feel pressured. This is your life. We have the pleasure, the honor of walking the path with you. Change your future. Don't stay where you are unless you're living your dreams now. Start doing the things you know you need to do to reach your dreams in 6 months, in a year. Don't stay where you are. It was our pleasure to do this with you guys today. Thank y'all again for coming to our workshop. I hope that you guys, if you're not going to change your life, that maybe you at least learn something. Again, go snoop on me. Feel free to go to YouTube, check out all the articles and everything, and make a wise decision for you, your future, your family. Thank you guys again. And Rob, I have no idea how to end this. So
just close the browser, I'm guessing.
so I don't think Katie's on here anymore. So I guess we'll just leave and close the browser, and hopefully that doesn't leave people hanging.
All righty.
All right. Thanks, guys.
Everyone. See ya.